Hello, fellow nurses. I'm very excited that you've had the opportunity to attend this Leadership Academy for Nursing. Just by your interest and attendance at these seminars over these last weeks, you are exhibiting leadership qualities through your desire to learn and develop within your profession. As nurses, we are entrusted with grave responsibilities and obligations to the people we serve. We possess a distinct body of knowledge and science with extended practical training, unlike any other profession. You being here today demonstrates your commitment to excellence and recognizes the need in our society and our profession for a new style of leadership. One that involves working with others as full partners in a context of mutual respect and collaboration. We've come so far from being the handmaiden to the physician. As the most trusted profession and the largest component of the healthcare workforce, nursing leadership is needed at every level and across all settings. The concepts of leadership that you will learn from Margaret encompass much of what seasoned, successful leaders have learned over their years of experience. I am celebrating 50 years of nursing this year. My first 25 years of active clinical practice was in critical care within a hospital, and the remaining years I engaged in administrative practice. In each setting, I was in a role that required the skills of a leader. The one skill that comes almost automatically in nursing is communication. You can't be a nurse if you can't communicate. If you think of the type of work we do, think of us as the hub of information, reporting information to a wide variety of recipients, family, physicians, other nurses, other disciplines, and I could go on and on. Refining this skill is the cornerstone of any leadership role. Of all the good advice Margaret will share with you, the most important formula to a leader's success is listen with the willingness to be influenced. Back when I was president of the medical center in Sioux Falls, before I became the chief operating officer of the system, I learned this in real time. You know, when we went to school and educated, we learned how to communicate. We would learn how to sit with the patient and listen. We'd even have to go out and record some of the conversation that we had with our patient. And then it was graded. So I learned all of the academic techniques of listening, but I really didn't listen. I was already formulating my answer. I was already formulating my next steps. One day, when I was president of the medical center, my chief operating officer of the hospital and I were traveling to Pierre. As a matter of fact, it was for a SDAHO meeting. And my mantra had been listen with the willingness to be influenced. So he gets in the car, I'm driving, he gets in the car and he says, okay, I have the next 3.5 hours to convince you of changing your mind on a decision that you've made. And I said, oh, really? And he said, remember, listen with the willingness to be influenced. So I thought, okay. I said, what is the topic? And he shared with me the topic. And I said, okay, but I want you to know that I'm really, really pretty strong on this decision. So you're going to have to work hard to influence me. And he said, my team and some of the staff told me this would be a tough hill, but I'm ready. So we talked about it for the next while on our way to Pierre. And I listened with the willingness to be influenced. And sure enough, I modified my decision because I was willing to listen and be influenced. That is the cornerstone of communication. And today, I know that you'll be listening with a willingness to be influenced. Have a good day.